Hi, I'm Cillian. I'm the co-op student here at Museum Strathroy-Caradoc, and because of my ever-growing interest and passion for history, and my just general exploration of our vast collection here at the museum, I found some pretty interesting artifacts and objects to, show off to anyone who may be interested. And that seems to be you guys. So, last time we talked about the HMCS Strathroy, but this video here we're going to look at some medical marvels, if you look at the title of the video. So we've got 4 lovely artifacts here. I'm counting these as 1, but for being precise we got 5, but these are a little pair. To learn about in great detail, so maybe you'll learn a little something new they never really learned before. So thank you for tuning in, hope you learned something, and let's start by talking about oil wintergreen. It is stated very clearly on this bottle that wintergreen oil, or oil wintergreen, is for external use only. That is because it can be very, very toxic if ingested, due to the, checking my cheat notes here, methyl salicylate within the oil. So much so another label on this bottle, right here, describes it as poison, and says that it is required by law to say that it is poisonous. If we are looking at the stickers on this bottle though, we may as well look at the biggest one. Stepler Drug Store, the Rexall Store, Strathroy, Ontario. So it is located on 35 Front Street West. It is still a pharmacy, still a drugstore, just now it is Boston's and has been Boston's since 1965. The building itself has been a drugstore for 125 years as of this year of 2024. The building was built in 1877 as a grocery store, but turned into a pharmacy in 1899. The space above the drugstore was rented out to a variety of different businesses, including R.S. Williams Photography Studio. So here we have an up-close picture of our bottle of oil wintergreen. Oil wintergreen was used traditionally as a cure for colds, headaches, sore throats, skin conditions, colic, tooth decay, and bacterial infections. That is because of the immense amounts of anti-inflammatory properties that was inside the oil. So here we have the trephine. Hold it like this so you can kind of see it. The trephine is a very interesting medical device, which we're going to talk about the history of in just a second. But I'll show you kind of how it works. So it looks a lot like a corkscrew, but instead of opening bottles, this thing is to open up patients' skulls if we need to get into the brain. So I'll show you kind of how it works. So if this is our patient here and he suffered a head injury around this area of the brain, I'm going to shave off the area that I need to get into because no hair can be in there. I'll then take the trephine, and there's a little spike and that'll start us off. Take that in, and then I just twist. And while I twist, I'm drilling into the patient's skull, where I can then gain access to the brain and work on it from there, with whatever I need to do. Through accounts, it is documented that this is a painless procedure. I'm choosing to believe that without trying myself. I don't really want the trephine used on me, and I hope you as the viewer don't want the trephine used on you as well. Wouldn't be too fun. So the trephine was invented in 1639 by John Woodall in London, England. As mentioned, the trephine was used to drill holes into people's heads, but why? It started as a solution to mental illness. In the mind of the early doctor, it said that all matters of health were caused by humors and vapors, whether good or evil. So when it came to people with mental illness, the only solution in their mind was to cut a hole in their head and let all the evil come out. This didn't work, but they gave it their best shot anyways. The action of drilling holes continued to be a standard medical practice when it came to all things related to the head. The invention of the trephine in 1639 brought some humanity to the practice, as, like I said earlier, the patients claim to have said it causes no pain. Also, like I said earlier, I believe them. I don't want that tried on myself. The procedure continued with the trephine at the front line of all operations. If you suffer from bad headaches, high levels of head pressure, brain damage, fluid buildup in the head, or any other thing that could be messing with your head or brain, the doctor had his trusty trephine ready for action. These procedures were used all the way up until the early 20th century because in most cases it did work. Depending on the environment where the surgery was carried out, there were higher rates of success. For example, if it was in a patient's home, which is more sterilized, weird, I know, I'll get to that in a minute, then it's more common that the patient would survive the surgery. However, if it was carried out in an early hospital, which were filled with germs and a lack of understanding of them, as hospitals at that time were just a place that were filled with germs and disease, having a big hole cut in your skull was not always the best course of action, and the survival rate barely reaching 10% due to infection in the brain. Overall, it was a 50-50 procedure depending on where it was. As time got closer and closer to the modern age, the art of Terfine was beginning to die. There was a better understanding of medicine to combat minor illnesses and injuries, a greater understanding of germs and less drastic operations to deal with many of the problems that Terfine attempted to solve, and an understanding on mental health. However, it was still used for the most extreme of head injuries, so it became very common as a wartime medical instrument. If a doctor needed access to the brain due to shock or possibly shrapnel or a bullet to the head, the Terfine was the tool for a quick, easy, simple, and painless procedure and very fast to heal if the patient survives. This Terfine that we have in our collection belonged to Dr. McFadden. He was a wartime doctor of the First and Second World Wars, serving in the Canadian Army Medical Corps and returning to Canada working in private practice. I am unaware of when this Terfine was used in his career, but it was his nevertheless. Now we have our third artifact. This is the Branston Violet Ray High Frequency Generator. Though to keep the name short while I'm talking about it, I'm calling it the Branston Generator. The Branston Generator is a mobile instrument for electrotherapy using violet rays. It was sold and used throughout the early 1900s from around 1910 to roughly 1920, being invented, produced, and sold by the Chassé Branston Company out of Toronto, Ontario. When it came to advertisement, it was directed primarily to women, with the majority of images we have showing, of course, women. When in use, the Branston Generator's two light bulbs would glow an eerie violet light. It would also produce constant vibrations and heat. Certain uses of the generator relied heavily on that heat, burning spots into patients, with one section on the manual saying you will recognize the machine is working if you see the look of pain on the patient's face and the smell of odor of burning flesh. Along with the manual, we also have a catalog of different implements that were available for private purchase. The Branston Generator claimed to cure nearly all things terrorizing the modern person's health and well-being, offering a quick solution for most issues experienced by, as mentioned before, primarily women in the early 1900s. For the most part, it did help short-term, curing aches and pains until they came back again a few weeks later. The idea of electrotherapy was not only used to cure aches of the body, but also mental illness. The practice of electroshock therapy for mental illness fell out of practice around the 1960s. However, by that time, items like the Branston Generator had since been long gone, as the practice of electric treatment had become very specialized and reserved. However, one practice that still has not fallen out of our history, yet was popularized at roughly the same time, is chiropractic medicine. Here we have two sections of a newspaper ad stamp from around the 1920s, promoting all things that this newfound practice can cure, alongside with a diagram of human body highlighting the spine and nervous system. The full ad reads, "Chiropractic adjustments, remove the cause, nature cures, result perfect health, no failures." Quite the bold statement, but for a newfound medical practice that the public is unsure of, when they hear of all these miracle cures, their minds will be blown and support for the practice will skyrocket. The only issue is that a chiropractor cannot cure some of the things it claims to cure, such as tuberculosis and diabetes or even heart disease. We know with modern medicine and a modern understanding that your spine and nerves have nothing, or at the very least extremely little, to do with these conditions. However, in a world where there is a new practice and cures for these conditions is highly needed, the public will try anything.